Well, a new Canadian health technology startup company called NIA Health is working to address the disconnect between the ample amount of data we have in the country's healthcare system and patient outcomes and patient health. Our guest says the real problem is not a lack of data, but the fact that no one's looking at it effectively. We're joined by Dhar, co-founder and chief executive officer of NIA Health. Samir joins us right now. Samir, thanks a lot for joining us. First of all, tell us a bit about your company. What exactly does it do?
Great. Thanks for having me, Paul. NIA Health is Canada's first end-to-end proactive health partner that combines advanced diagnostics as well as deep insight from clinicians and integration with wearables to provide truly comprehensive insight into people's health span risks and the most actionable set of things that they can do to get in front of that risk.
So one of your views is that Canadians have never collected more data about their health. In fact, Brooke Thackray, my guest in studio, and I are both wearing Garmin watches right now. So we're part of this group of people that are constantly getting pinged about our heart rates and our footsteps and so on. But your view is that Canadians are not getting healthier despite the collection of all this data.
Correct. And it's interesting to note that approximately 40% of Canadians have and own a wearable like the two of you. However, physicians are only looking at about 15% of folks with wearables. And so there's clearly a gap between the amount of data being collected and how we're interpreting it within context. And I think that's one of the issues that we at NIA are trying to address through combining both advanced biomarker data based on blood, VO2 max, DEXA scans, gut microbiome testing, other advanced diagnostics, but interpreting it within the context of clinicians looking at the data. So licensed clinicians actually looking at the data and being able to tell us, hey, here's where your risk lies. And within context of their clinical knowledge base and understanding, being able to provide us with insight that we can act on.
So how does it work then? Go from the actual person who's got a wearable to having that data now go to the physician? Like, is there a portal they have to enter the information, or can it be done automatically? You just link up your Garmin, let's say, through Bluetooth, and it goes up. How does that work?
Correct. Yeah, you would integrate your wearable with our platform, and we would actually requisition blood work and some of these other diagnostics. So you're actually combining both the blood work and these other biomarkers with your wearables automatically. And then our clinicians are looking at that overall picture in combination with your medical history to say, hey, here's where your biggest risks to health lie. Here's how these risks are placed within context when you look at what your blood's telling us and what your other markers are telling us. And here's how your lifestyle decisions and the ways in which you're exercising, your sleep habits, et cetera, are playing into the risk that we're finding from your markers in totality.
So I get the impression that you believe the raw data collected by wearables, which are consumer products, Apple Watches, Garmin's, other branded wearables, is high quality data. Do you? You think the raw data is of high quality?
We believe it is of high quality, but it's important to place it again within context of your other health markers and health risks, so that you can come up with plans that are truly actionable. And you know, I think in a regular doctor visit, where you might have 10 to 15 minutes with your physician, you might get a response like, hey, you've got high cholesterol, perhaps consider exercising more. But what we're finding is that that type of guidance doesn't necessarily lead to behavior change and people actually acting on those recommendations. And so I think it's very important to include more specific wearables-based data around the different zones of exercise, for example, that you're using, and how you can actually focus on certain zones of exercise, zone 2 versus zone 1, for example, to be able to optimize your health outcomes and to actually, take those next steps to reduce your health span risk.
So I take it AI is going to play a big part in this and parsing through the data and coming up with possible recommendations. Are you going to be reporting to the physician or the client or both? How does that work? Who actually gets this information to use? Does the end user actually get it as well from you? Like I know in the UK, they're looking at a doctor in your pocket type of thing. So the person's interacting with AI specifically and it's going back to the person.
Yeah, so at NIA Health, we believe in a clinician-led model of care. So we do provide access, and frankly, you have access to your own wearable data. However, in our model, we're trying to take the most evidence-based diagnostics in addition to your wearable data, and we provide that to the clinician to take a look, to come up with what the overall picture of your health is really telling us, and to basically winnow that down and make it super simple and easy to understand. Here's what the clinician is seeing overall in terms of your health risk, and how the most actionable things you can do driven by that wearable data can land. And so yeah, we really do believe in a clinician first model of care, whereas we see a number of health tech startups going and trying to say, to your point, Paul, that you should just have a doctor in your pocket and in some ways take the clinician out of the loop and rely wholly on AI. AI is super important as part of the equation to make the clinician's job more efficacious. But again, clinician-first led model here at NIA Health.
Okay, we're running out of time. Talk to us a bit about the company itself. It's a startup, it's private, so you won't disclose a lot of financial data. Can you tell us anything about sales trends? Who are your customers? Where are you selling geographically? What are your ambitions for the company 5 years from now?
Absolutely. So we are currently operating in every province in Canada other than Quebec. We hope to get to Quebec by the end of the year. And we've been growing 30% month over month since inception. And so, we're super excited about Canadians across the country wanting to be more proactive about their health and trying to find ways like NIA Health to get on top of their health in a way in which they weren't before. In terms of 5 years from now, we hope to entrench our position as the leading player in Canada from a proactive health perspective, but also our ambitions are global, because we really do believe we've cracked the code on how to get insight into your health and own your own health outcomes.